All right, then this afternoon on top the show, we got with us Mrs. Shola Hassan, and she is a Lagos State Health Educator. And together this afternoon, make we still, continue matter on top the coronavirus pandemic where they are there, because company like say people really want to talk about them. Even as we get the directive, then we don't full ground where they left, right, center now. So, Sister Lee, good afternoon first.
Good afternoon, everybody.
You're welcome.
Thank you.
Okay, so COVID-19 and the matters arising. The way the matter they take you right about now, Madam Hassan, it be like say our people, we don't go back to life as usual, normal life. We know they look the new normal. If you see about the weekend for 1 o'clock Pigeon News, you still say La Sepa GM dollar per fashion, where she still go they lock some places. Where we say beer parlor. I tell you, for some places for Bodo Lagos now, people don't they live normally. Beer parlor don't open. She been like the one where La Sepa say go close. If you don't see how? Why? You feel to help us bring people back to what thing we need to dey sabi about this COVID-19.
Thank you very much. The thing where they be say, I just want to make people know say coronavirus is still there our country. It's still there Lagos. And now Lagos, the thing boku. People think say na as they say make them ease lockdown. Everything done normal be that. But I just they tell people now say this COVID-19 where many people they call coronavirus. Is still there.
Sickness we get AKA COVID-19
is still there for our country, for our state.
But what thing they make people then they believe say I beg all this thing be like saying scam, or some they say I'm a scam. They say if he day, why them never see those where they follow the entire motto, they gist talk say they see them or say they get person we get them.
The thing where they there be say the people where they isolation center. Then those people then be people where they call asymptomatic cases. Okay. The people where they show
so then get them.
So then get them. So now make the government want say make them they treat them for house safe. Because the people where they there, they know they show say they get the disease, but they still get them. And the people where get the disease safe, then feel they transmit them to people.
For this one where you talk now, maybe we can look at now. She not the fear or the things there where people go, the stigma where they follow this and they make our people know.
When they say person where even get them, no go fit talk saying get them or say
now the thing where they happen with that. People where get them, they don't want make them even show their face. Not to talk of say I won't come and say I get the disease before. Now I make people where they for our state. No one believes say the thing they. But I want to make everybody know now, say, this thing still there for our state. And it go up. It increase every time. So make them know, say, this thing not be joke. Not be joke. So make them know, say, this thing, not be the disease where be say they kill. All right, so make we call look like,
no, should we talk about, say, they kill? It be like waiting.
I say, they kill. But it be like any other disease. Like where person say he get hypertension now, or make person say he get diabetes, or make person say he get malaria or anything. Now all those disease, this one will just come too. It be like so then fit treat them. Not be say they no fit treat them.
Okay.
So
not be death sentence.
Not be death sentence. So all this one where people they say I don't want make them know say I get them. Now I make the thing still the boku for our state.
Shade, before you go ask your next question, Madam Hassan, a lot of people they believe say now rich man disease or rich man sickness, COVID be because people see they enter buses, you they see BRT, moto, you they go everywhere. People don't begin enter plane again, and for people they enter buses, you not see person today, you not see them tomorrow. So for their mind, if you go ask them, they will say now rich man disease, Jare, concern poor man. You don't see any poor man where the thing catch. Now the question be that.
Look, if they affect poor man, if they affect rich man. This disease where we they talk, you don't know anybody. If they affect everybody.
Even Peking.
Even Peking, where get in contact.
Peking will never reach 1 year.
Where anybody will get in contact with the person will get them, himself go get them. We don't know the person will get them. So that is why the government say make them they use face mask. So that you go protect yourself, you go protect the person where they near you. So then say make them they use face mask, make them they use make them they wash their hand regularly. Make them they if they not see water and soap, wash hand. Make them they use
the sanitizer.
Sanitizer.
All right, so we could come to the level of testing now. How well we don't take worker for that one now?
Government don't increase the way then they test, like the time where this disease starts.
Okay.
They don't increase them. They don't approve private
Laboratories.
lab now where then they test. Then for NIMA then they test. For Lagos Mainland Hospital where the isolation center dey, where be the one where be the Obonge one, then they test for there. Then they test for Lut. Then they test for all those places.
All those ones are the government.
Now the government one and all the tests now free.
Free. But for the laboratories where government just assigned, that now free for there too, or they go pay?
Then they pay for that one.
For the one where government assigned. Like
yes.
how many of them?
Like seven.
Seven of them. Okay.
7 of them.
Okay. You want to mention where them dey?
No.
Okay. No worry. We go checkmate something out of that one also.
The thing where they there be say, if the people want know, if they want know where in dey, make them go our commissioner handle.
Okay.
Then go see all the places where in dey.
Okay, but we say we go try find out one out for here.
But all those ones where we say na private, then go they pay for that one.
If they go do test for that
If they go do test for that one.
But look, it's no verse maker. We can still look at now. How long the test they take now?
The test now,
and the processes then where they involved for this testing now.
Now 48 hours the test day now.
Okay.
Now if you do them today, 48 hours they don't call you say your result
don't come out.
They don't come out. Yes.
Okay. So
so if
that's one of the processes, I just try imagine saying all the things
and then for all the local government them, then they test there too.
Oh, good.
All the local governments.
The local government. Then they test
the 20
there.
local governments.
The 20 local governments.
Then they do test there.
I dey checkmate the hand way you don't see my go, and I dey see the one where Professor Akiabayo maybe give for the 7 private laboratories. We get Total Medical Services, we get Synap, we get 54 Gene, we get Medbury Medical Services, Biologics Medical Services, O2 Medical Services, and Cleaner License Laboratories. Okay, now the levels be that, and we still get the one where they say that they do combined capacity of 2,000, where they still test for COVID-19 samples for the state, like the one we mentioned for Lut, Idiaraba, Lagos State Biobank. We get the Nigerian Institute of Medical Research, NIMA, and the Central Public Health Laboratory.
Yes.
Okay, so this and many more. And so since when I don't begin to do this, because I know say at some point. The man will be turned up for front of this fight against COVID-19, His Excellency Mr. Governor Babajide Sanwo-Olu. If we don't talk, say if this community to community transmission level and everything, so therefore we they carry health workers and those where the matter concern to we community to they informate with people them on the things where they need to do to avoid stories that touch onto COVID-19. How far with that one?
That one said they go. We they do them now because say. We talk say we want all the people who know they show symptoms. We don't want put them for isolation center again.
Okay.
We won't put all the people where they say their case be
those will get correct
they say their body don't they shake and everything, or which one?
The people who not fit breathe well.
Oh, okay.
We get severe
cases now.
When their body don't they shake. Now they will put for the isolation center.
Now we won't put for isolation center. All those ones where they say they waka around.
No show for their body.
No show. Now home based care.
But if you not show for their body, how will I take do tests for them?
Sometimes if you be saying now only cough, then they cough. If you be say then just they get
high fever.
If you be say they don't come in contact with person where get them,
where they later say get them, where they don't know before.
Where they don't know before. So the person said go say it be like say this person get this thing as done positive and we don't talk together, eat together. Make me say go do my own.
Okay.
So now the thing where they bring them
but even as we still they talk about this one now. What will be some of the challenges then? We be saying that they get as now they do this work now. Because say Lagos now we get different people who come
over
together.
20-something million people.
So what will be the challenges now where they facing now, even as now they do now?
The challenges where they there before be say the test dey overwhelming. People where they do the test, you know, as the thing they increase now. Now with the test.
They increase. And there the one carry you go before you go answer shadow question. For Bodo Yibo, they don't do over 40 million tests, and that is why the cases where they get there, be like saying it won't plenty, maybe second or third to Spain and other. Nigeria, we as at last week check 189,000 something out of 200 million population. If we go checkmate and with waiting our government the yarn,
not the increase now. The one where
they say if we begin increase like America, it could be like almost everybody go get this thing.
It go be overwhelming.
So what's be the way out?
The thing where we say we want educate our people. We say make them take personal responsibility. The thing where I mean by that we say make them they use their face mask. Some people na chin then they put the face mask.
For where baby
supposed to na there then they put the face mask. Some then go put the face mask for up. Some they not even put at all. Now if you ask them where your face mask, I say it's there for my pocket. Not be pocket then say make them put the face mask. Now the mouth you go cover nose, you go cover mouth. You see, say the time where I come inside your studio, the thing
cover everywhere.
I use and cover everywhere because you don't know the person where gets this.
That is why we say far from you say far from us because nobody know anything.
Now the thing is that where government say make them they do social distancing. Make una give yourself 2 meters
space
apart. Then washing of hand regularly with soap and water. Now the place where you don't get soap and water, you go use sanitizer. But regularly, they say this thing, all this thing,
it's simple, right?
They hard at all.
But what you go talk for bus drivers? When they say they carry passenger, we no wear face mask, and they always get inside their safe mask where they give, so that police no go harass them or road safety no go harass, and the passenger go use them when he want drop. Oga they drop a pada, he go drop him. Another person go enter, he go give him. Hygiene level, coronavirus. Where are we going?
As the thing
some they wear their own for more than 1 month.
As they talk with that, as they talk then they spread them. Then they spread the disease because now
that is if the person will get them, go
wear them. Now one mask for one person, and if na cloth mask, you go wash them
before you
reuse.
Wash and iron.
Yes, you go wash them, you go iron them before you reuse. If na surgical mask like this one where they use, if you use them for 1 day, in the evening you go throw them. If you want go eat, if you remove them, you go throw them. Use another one, yes, because say as the thing there for neck, the particle of the disease, if it don't stay for neck, and if I put them for neck like this, I want pull them up again. The thing
carry the neck now go
carry and go mouth.
Okay, before we go to this break, I need to ask her the face shield where our people they wear. I know say NCDC
they don't turn the face shield to fashion
decoration.
Then go use the face shield without mask.
And is it wrong?
They not protect anything, no.
If you use only face shield,
they not protect anything. They must use their face shield with the face mask.
Wow.
That is the only way they can protect themselves.
Because this thing they airborne. Last week they begin talk.
Yes.
Wow, we go for break soon.
No, before we go for that break now, make we try relate with people where they out there. You get 1 or 2 questions for we friend with inside studio this afternoon. Now your time today 0809-912-0777. 0809-912-0777. That number to take relate with us inside studios with that this afternoon. Hello, who there with us?
Good afternoon, ma.
Good afternoon, Oga Baton.
Yeah, good afternoon, ma. I greet our madam dear. You're welcome, ma.
Good afternoon, I dey hear you.
This coronavirus, I like the way Nigeria take it. We take it very serious. But that's about. I have a question over it. I agree that this thing is increased. That there is coronavirus. Number one question. The staggering number we are announcing every day, 150 today, 180 tomorrow, so next tomorrow, 300 yesterday. Where then they keep all of them?
Okay.
That's my number one question. Where then they keep all of them? Now, people say coronavirus is a thing of the mind. It's working, it's around true. But there is a state in Nigeria. That state refused to submit, say you will never agree. And they never see any mass death in that state. I will not mention the state.
No, now Kogi, all of us know. No, the news. Now Kogi.
And then if the way the man take it, saying no want any hospital, no want any quarantine center.
Even the chief judge died for them. We know.
We supposed to don't see 500, 300 on the road every day. We never see it. That's what people are saying. Is this coronavirus a thing of the mind? Somebody say if it's at the hem of our fear, if we just tell people, remove it from your mind, go about your normal duty and do your work, protect yourself. Don't let anything affect you. He said with time, the thing will go, but the whole world, from the top of the whole world up to down, all of them are worshiping coronavirus. And hence, the name is increasing. We don't know what is really happening. Then, because all this staggering number, we shall speak to them day. Where they keep all of them? That is what people are asking me, and I don't know.
Okay, but you hear when Madam Hassan be talk say that they treat some people for house now, especially those who be say they get them, but they shave for body.
I agree with you.
But those who be say their own day serious day for isolation.
People for house. Who is taking care of them?
Okay.
Now they say church and mosque should not open, but market is opening in a large quantity. The market open more than church says. Everybody they go about their normal duties. Okay. How can government contain this thing?
All right, just a listen. She go free answer that one. Madam Hassan here with us this afternoon. 0809-912-0777. We don't get question one from Oga.
But we fit tell them for free because of person if they listen to drop away they go say for churches, for mosque now enclosed environment. How many churches then they do service like crusade these days?
No cross ventilation.
No cross ventilation. Like for market, I come, I go immediately, depending on what I they do. So make we not get them twisted. Nobody say make religion level, no do anything.
All right, for WhatsApp, somebody done the same video of how the market take look now. Hello, good afternoon.
Good afternoon, MTR. Good afternoon, Madam. Hello. My name is Obizenas.
All right, so Obizenas.
The madam talked something that time. Because the face mask might be the issue I get as I did so. I don't have so many places.
I take the issue for you.
If I drive car alone, madam, am I supposed to use it? If I drive alone for the car, if I don't carry anybody, I just wind up or I wind down. Only me inside the car. I beg.
Okay, she go free answer you. But I know say NCDC don't put a lot of things on top that one still. 0809-912-0777.
Make we take we fit take plenty calls. Times today. Good afternoon.
Good afternoon.
Good afternoon.
Yeah, this is Kazim speaking.
Okay, Kazim from
the airport road, the local airport.
All right, let's go, Kazim.
The only issue that I have, and I want to ask the woman, they said if you have COVID-19, it should take 2 weeks before they can say you have it. I remember when my brother wife came back from the America.
But things don't change now.
The husband isolated her for 2 weeks.
Okay.
Before he told her that our wife is back to Nigeria. But the first day they hit us, I knew that COVID is real. But the first day they hit us, that we should go out. Is that very first day they have the IS number? How did they detect that IS number? That very first day. That is why I'm so confused. And that's why people are really complaining about. Why is it that they said it's after 2 weeks they can know that you have COVID? Why is it the first day they ask people to go out, and then first day we have the IS number? So that is where the confusion is. I know COVID is free.
Okay, Kazim, make I help you right away. Now, don't forget, say, like I talk to madam. If we not do tests, we go get lower level. Kogi, they live in denial right now. We know people, Chief Justice died. They just swear in another one last week or Monday or so. We all know these things, right? Now, if you not do enough testing, you not go get enough results. Right. Now, the day when they release us, proud to that day, or some days, you know, say you get one time where we say Lagos be not get anything, not like 2 days after the release us or so, because of one or two things. By the time where all the samples where they don't get, where they go check them, release the results, everything go up again. If you don't do checking, you know go get, say people get them. See America, for instance.
I always watch CBC News at 10 p.m. I don't miss it. I always check out updates. I always call my children, come and watch the news. See, COVID is real. I always call them. Once it's 10 p.m., we listen to the news. But I always check the results every blessed day. That was the reason why I knew COVID is real. But the way our government is taking their times, so people don't want to believe them.
So you just get some belief, say some things still follow for the matter now.
And I think they're waiting because last week Tuesday on top of the show they asked say why you dey wear your nose mask outside, and guess what people they, like 30% also because of police. It's because if police no go catch them, they no go wear them. They don't want believe. Some people believe say maybe na scam, like I take yarn or something. What do you get for those scam people before we take the next set of calls?
The thing where we get for them, we say make them just believe, because if they not believe, the COVID fit reach them anytime.
More like maybe they take precautionary measures.
If it reach them, okay, make them use their face
Good
mask.
afternoon. Okay.
Face masks properly, and then the person that was saying that they isolated for 2 weeks, the incubation period is for 2 weeks.
Okay, make me take this call. We go
Good afternoon. Good afternoon.
Good afternoon, Balashade.
Afternoon.
Good afternoon.
Now, she the talk.
All right, Tashishi.
The girl question me, I want to ask a very simple something.
Let's go.
They say, I agree. I know that Corona is real. Confirm. Now, they say if the Corona you don't have the medicine. Every day, you see that people like 40-year-old, they do okay, they don't test them, they do. Which medicine they are using for them?
Okay.
They say they don't have
Which medicine that they use for those ones where they do okay?
Yes.
Okay.
Yes.
I just say that the same medicine that they use for those where they house too. Where we say since their own nobody show and I that they use. Okay.
Oh my God.
Because of time, make we take one more. Then we go fit just answer everything straight up. Which medicine that they use for them where they have for them with the isolation center?
And those where they see they keep patients with the numbers, then when they go out there. Hello, good afternoon. Who there with us?
Shade,
Yes.
I just want to tell you now, say we have a problem in, we lost somebody in our group. Baba, we they pray for now. Baba Jai, we they pray.
Baba Jaye.
And you don't so the man died today. I think I tell you now.
Baba Jaye, we always pray when you call. Wow, I just
Thank you so
we go
much.
pass the
We
message.
go, yeah, definitely.
And make him, God give him family the fortitude to bear the loss.
Yes.
All right?
Hello, good afternoon. Hello, good afternoon.
You see, you are not taking responsibility. All right, you know they say we don't pick them. We take one more call and we go answer every as they concern the matter. Don't forget now lunchtime work I they listen to now with Money Monday with this, and this afternoon we decide to go with Health Corner, and we get Mrs. Shola Hassan of the Lagos State Health Ministry talking about she now health educator with the Lagos State Ministry of Health. Good afternoon.
Good afternoon.
Afternoon.
Okay, James from.
Educator.
All right, let's go.
I want to ask madam, this figure, what is it? Is it a patronized figure or just expected figure? I want to answer.
Okay. Somebody don't ask that question before now. I don't forget it.
Now Kazim from airport.
Okay.
So, madam.
Make we start from that one so that go fit take their two together.
The figures and everything, especially for Kazim, we talk say in children, they say that they check make the thing, but say the day when we resume, everything just go up. Say how it take be like that. I don't try to explain my own, but it be like say it need from you.
The thing where they say, as then they lock down, then see they do testing. All the testing we don't accumulate.
The samples of
all the samples we don't accumulate that time. and then release.
And anytime when they release them, you know, God me say it will show the thing of yesterday. If it be of 1 week,
if it be of 1 week, if it be of, you know, say I talk say we don't improve now. We be
with the
say
testing.
with the testing. We be say now 48 hours the thing they come out.
unlike before. How many?
Before, if you reach 1 week.
Yeah.
Because the people
during the lockdown.
During the lockdown, you know, say the places where we dey do am that time, you know, plenty. But now the places where we dey do the test, it don't increase. So if we do the test, then the results they come out, and then it be say, if it be say, if we do 500, if we do 1,000, the result come out, the positive one, it go high.
Okay, and the medicine where they use for them for isolation center, according to Asheshe, why none of you just tell everybody to use it for house?
Because if we tell, madam, make I even help answer this one. If we tell everybody that medicine, then go abuse them.
Just like when President Donald Trump, because saying they take chloroquine,
everybody go buy chloroquine.
And just like the other Madagascar COVID organics, then talk say they put
somewhere.
What be the tree now? Just to say the one for our company, they almost vanish.
So everybody just to try, just like we use salt for Ebola, people use salt for bath and all that.
So make we not do self-medication, no. Make we, the thing where the government say make we do, be say make we just take responsibility. Make we they use our mask, they protect ourselves. If you use mask, if I use mask, the two of us go protect ourselves.
Then
the figures, somebody talk say whether the figures na estimated figure.
True.
It not be estimated figure. Now the correct figure where them test, where they positive, now then they
so
release.
why people no want trust government across board as they take consign these figures? You get any idea?
I don't even know, because you know say for federal, then they test. For state, then they test. For local government, then they test. So normally figures go increase, because as the test they increase, 9 figures go they increase. But you know say at the time when COVID first come, then everybody here say they give Lagos State money. So now the money, because
now increase the test centers and every other etc.
No, I won't even talk the thing where we they use the money for.
Okay.
Because sometimes when we go, for people say, okay, make una they do this, make una they take precaution. They go say the money where government give you, make una go bring out.
It never reach our turn.
It never reach our turn. Make we go bring money, make we go bring this, go bring that. But I want to say the money, not be say government they use and play. The money government they use and buy medicine. The people where they for isolation center, then they give them everything where then they do for them now free. They not collect money for test. And before them discharge them, then if you do tests for them like 2 or 3 times.
And so, Professor Bidi talks say the test the amount almost 40 to 50,000 per one test.
And
they will do 3, almost 150 approximately.
Before they
we got to go, ma'am. Okay, you want to add something?
And then for all the isolation centers, the people where them they carry them, where then they go do tests. The equipment, the personal PPE, where then they wear. Now money. Now the thing when they use all the money to do that.
Even as you know, some people they put message for here.
Only me for car, you know, answer that one. You supposed to use the no signs.
Oh, okay, yeah.
He go ask us tomorrow.
If now only him where they for car.
He wind down, he wind up.
Make he use them. He they protect himself.
If you wind down, because
if he wind down,
make use them.
Make he use them. If he wind up,
now only because the thing they airborne, person sneeze around and make you enter in car.
Yes.
All right.
And you know, say all those people where they sell, then they come near the window.
Stick.
Somebody for WhatsApp that make government no send people come loot for COVID-19 test for now till after they construct the road in front of loot. Now Prince send that message to us.
So we gotta go. So maybe they never send people come that area because of the road. We
got to go this afternoon. Thank you so much.
That one doesn't make they know waka now.
Thank you so much, Madam Shola Hassan. You the Lagos State Ministry of Health Educator. Thank you so much. Regards to Oga Abayomi.
Thank you,
Abayomi, Commissioner for that.